the numbers are looking like for COVID-19 and how that is currently continuing to spread.
Yes. So what we've seen in the past few weeks as we start to open is, I believe towards the end of May or beginning of June, we had some really low numbers, which was really good. But since we started to reopen, and we knew this was probably going to happen to some extent, the numbers have not gone dramatically up, but have stopped going down in some ways, with some of the average numbers, which help to balance out some of the jumps and like lows and data issues we're getting with this, are just higher than the numbers we had seen obviously during social distancing. Like I said, we knew this was going to happen, but it definitely sets a precedent of how are we going to manage this in the future? What are we going to do to make sure that we're safe and that this reopening is successful and just not a moment in time before we have to go back into shutdown?
Exactly like you said, it's difficult to be able to see some of those initial trends that were positive, that were reopening, things were going well. But in particular, in our section of Southwest Ohio, Mike DeWine came out last week and talked about the fact that there are some worrying trends in the Hamilton and Warren County areas in particular, and primarily right in our own community and home district, District 54. The zip codes in Lebanon and Mason in particular have seen continued increases in overall case numbers as a whole. And these are obviously great concerns, considering we want to be able to continue to try to manage this reopening process. We want to be able to see businesses continue to stay open, that we're not having to resort back to these old stay-at-home orders that were in effect in previous months. But at the same time, we can't be unwilling to accept the fact that it's here to stay, and it is continuing on, it is continuing to spread. And so there are a lot of different ways in which we can handle this virus and manage the continued spread. What are some ways that different states or just different parts of the country, our state, our community, what are ways that we can work to continue to close down that spread?
Yeah, so one of the biggest things is obviously wearing face coverings. We didn't see that recommendation until deeper into it, but obviously we didn't know a lot. And I know we were talking earlier, we saw that recent study from a research group that showed that the high population of people wearing face masks in public places and crowded places, especially as we start to get back to normal, as we face the fall, going back to school, universities, all, work in different places, that face coverings could play a big part in preventing a massive second wave. Like, second wave is getting thrown out there. It's a fear that it's going to happen and that everything's going to be shut down again. But this study showed that, in the same way, well, not in the exact same way, but in a similar strategy, that high percentage of the population having vaccines creates herd immunity so that the people who are vulnerable are protected. A high percentage of the population wearing masks can help prevent the spread, can help lower the amount of people who are passing it on to other people and who are getting it from other people, enough to hopefully prevent a second wave, which was really promising.
The issue of masks has obviously been politicized unnecessarily in the last month and a half. We should be able to just listen to whatever public health experts are telling us and to be able to say that that is the correct way forward. This is the way that the science, the evidence, and the fact shows that these particular steps would allow us to continue our reopening process. They would allow us to continue to sometimes operate within 6 feet of each other when we are unable to avoid those particular circumstances. And so it is incredibly concerning and disturbing in a lot of ways to see that there are so many people, elected members of the State House and of Congress, that are so proud of the fact that they don't wear a mask and that they don't think it's necessary. Because the primary purpose of the mask is not even to prevent yourself from receiving the virus, it's to prevent transmission from you to others. And because we've learned that asymptomatic carriers are continuing to be a primary point of concern for how this virus spreads, even if you don't have the symptoms yourself and you haven't gotten to get that test, you still could be spreading the virus to another person and then on to the rest of their family as well. And with close to 120,000 Americans lost to this virus so far, that's an unacceptable price to pay for a point about whatever your personal pride happens to be about you keeping your face uncovered. So I'd encourage everyone to ignore that segment of leadership that refuses to acknowledge the basic facts of medical science and to follow what public health experts are saying. So face masks are a part of it. We've obviously seen other states are doing better in some ways to respond to this second potential wave. Is there anything else outside of face masks that we should be primarily be worrying about?
Yeah, so it's intermittent social distancing. We know that. Doing our best to limit unnecessary contact. When people can work from home, especially as we're adjusting, there's not really a need to bring them right back into the office when things are running smoothly. And then there is the potential for localized shutdowns. But now we know how to do that, and we know how to prevent it and track it in a lot better ways. And so I'm really hopeful that our newly informed public and that our public health officials can work together to localize and really strategize our reactions to possible flare-ups, to keep the economy moving, to keep people social, and to keep things as normal as possible while being as safe as possible.
Those are all great points, and it's something that's been obvious for months. It's what we've been told. We just need to be able to accept, and it sucks to accept, but to accept the fact that it's going to be a part of this world until we have a vaccine to be able to prevent further spread, and until we're 100% positive that you simply having recovered from the coronavirus itself actually means that then you are immune from the virus and then can't spread it on to others. We currently don't know that, even though there is some level of antibody testing and otherwise, that we don't know how long those are serving as an immune factor for this particular coronavirus. And so if you think you do have particular symptoms, if you have those different levels of fever, if you are experiencing COVID-19 symptoms, please try to quarantine yourself, get a test if you can, particularly in this part of the state with the increased number of cases that we've seen. The governor has ordered the National Guard to be able to expand some of those pop-up testing locations. And so if you can, try to get a test there if you're feeling any symptoms or otherwise, and then just take the basic safety precautions. Is there anything else statewide that on this particular subject, Paige, you want to bring up?
Yeah, and so we've obviously stressed safety as a big part of this current live stream, but I think my last point would be it's been in the news a lot. The political stream, particularly the presidential race, is starting to pick up again. I know it kind of seemed like it was taking a little bit of a pause while we all focused on ourselves and public health, but it's starting to pick up again, and we're seeing rallies and events, and it's just kind of hard to social distance at a rally. It's hard to social distance at an event like that, to be safe at an event like that, until we know more, until we're sure. And so the only point I would have to make is that we just need, especially as we see Ohio is possibly turning into more of a battleground state, that obviously we want to protect democracy as much as possible. We have to be conscious about the ways that we do it. And we have to understand that maybe huge public in-person events aren't the best option. And then as we even look further down the road, figure out ways to ensure that people can vote safely and effectively.
There's a couple of points. We've got like you talked about, the rallies are going to be obviously a major concern for potential spread, especially if we're not seeing people wear masks to either protests or rallies or whatever it has to be. But to see the rally last week in Tulsa and the lack of masks is concerning, knowing that the potential for the president to jettison into Ohio as now a swing state and try to hold some kind of rally that could end up increasing community spread. So that's obviously a deep concern. And on the democracy front, knowing how Kentucky decided to operate their elections by closing hundreds and hundreds of polling locations and minimizing the number of options that people have to vote, particularly removing polling locations in minority-based areas of Kentucky, is deeply concerning for how we're going to end up confronting this election cycle in November. And we also have to be prepared for the fact that we will likely not know a winner for the vast majority of races on November 3rd. There are going to be far too many ballots outstanding, particularly in the presidential race, and any race that is at all close is going to be something we're going to have to wait upwards of a week to have any real idea of where everything stands, thanks to mail-in voting. And so we have to be prepared as a democracy to be that no matter how late you stay up on election night, no matter how much we enjoy that as a country, we are going to have to adapt to that fact and to accept that nothing is nefarious or otherwise about the fact that we're just counting votes, to accept that. So any final points, Paige?
No, I think that's all.
Great. Well, thank you so much for your time and for joining us, and for everybody. Please stay safe, stay healthy,